today I wanted to show you two different impressions and models for two BruxZir crowns that were sent out to doctors. And it just kind of illustrates a difference in the way I look at these crowns when we get to the cementation or the bonding process. But let's just start with the impression here. You see it's a double arch tray. Doctor used two materials. Things look pretty good as we go along the buckle. I like how that looks. As we roll over to the lingual, gets just a little iffy here, a little raggedy on the lingual, but we'll see what that looks like when we pour it up in stone. I always worry with these plastic double arch trays that they're going to be too flimsy, but as I squeeze this one, you can see that there's really not a lot of flex here. And this goes back to something that we've always said here at the lab, that if you're going to use a plastic tray, you really should use a stiffer impression material, a very stiff, heavy body impression material, so that we don't get too much flexure when we try to squeeze down on this. Alternatively, you can use a metal double arch tray like the Quad Tray Extreme from Clinician's Choice and use any impression material you want. But with the plastic ones, we want to use something a little stiffer, as this doctor did. So let's go ahead and take a look at the preparation. Again, this is for a BruxZir crown. And as we look down on it and try to close one eye, which you can't do with the camera, but we'll try to see, we'll put the buckle into undercut. We can see the lingual, and then we'll get rid of the buckle undercut, and we can still see some of the lingual. And so we definitely have a nice draw on that crown. It's kind of a feather edge margin all the way around, so it's very appropriate for a BruxZir crown. And I told you that I wanted to use this to kind of talk about the way we talk about cementation and or bonding with BruxZir crowns. And so typically what I'll do when I'm looking at a crown like this is to measure the crown. And anytime I have a wall where I have 4 millimeters of vertical height, I know I'm going to be okay cementing this crown. I could bond it if I wanted to. That obviously would work just as well, but I know I'm going to be okay cementing this into place if I have that 4 millimeters of vertical height there, even if I have a shorter height over on the lingual. And I think when we look at this, we'll see that we've got about 3 millimeters on the lingual. But with that 4 millimeter wall opposing it, I think we're going to be fine. So my regular routine at this point would be to cement this. So onto the prep, we're going to put some G5 desensitizer. And because it is a BruxZir crown and we tried it in the mouth, there has been some salivary contamination of the zirconia oxide material. So I'm going to use the IvoClean to remove those phosphate groups that are stuck or bound down to the inside of the BruxZir crown before we cement this. I'm going to use Ceramer cement from Doxa to put this into place because it also has phosphate groups in it, and so it's a cement that will naturally bond to the BruxZir material itself. If we look at a second impression, another doctor who requested a BruxZir crown, we can see again it's a plastic double arch tray, and as I always do when I see these, I squeeze these, and this is a dentist who hasn't used as stiff a material when I squeeze this together. And so you can see we see a little more deformation here. And I'm not suggesting that when we get this at the lab we start squeezing it like this or we squeeze it like this when we pour it up. It's more a matter of the patient biting incorrectly on it, and then it rebounds when it comes out of the patient's mouth. The fact that most of the polyvinyl materials that we have shrink when they cure anyway. I just prefer a stiffer tray, but trust me, there's been tens of thousands of units made on plastic double arch trays. They still work. A few little bubbles over there on the buckle margin, but far enough away. There's a nice spot right there. I can actually see material beyond the margin. I love seeing that impression material beyond the margin there, down into the sulcus. That disappears as we work our way back onto the lingual. But as I look at it, I can see through the teeth in front of the prep, so I know the patient was biting all the way together in maximum intercuspation. So that looks pretty nice for that second molar. Let's go ahead and take a look at the model that goes with that impression. And again, we'll rotate this just a little bit. And as I rotate it over towards the buckle, I get rid of that lingual undercut. So it looks like we're going to be okay. Might be a slight one on the mesio buckle. We'll have to see there. But the bigger point I want to share with you here is the vertical height on this preparation compared to that last one. On the last one we had 4 millimeters of vertical height, so I told you we would be fine to cement that into place. But as we look at this now, we're looking at 2 millimeters in most of the spots of vertical height. And of course the lingual is almost always shorter than it is on the facial. And you can see there, now all of a sudden we're getting just over a millimeter, maybe about 1.5 millimeters as we come along that lingual wall. So this is definitely going to be a BruxZir crown that we want to bond into place. So I'm going to use that IvoClean material again to clean out the BruxZir crown after it's been tried in. This is a crown where we definitely want the cement to stick to the restoration, and more importantly, we'd like the cement to bond to the tooth itself. So you have your choice of resin cements, a self-etching resin cement that you could use like Panavia 21 or Multi-Link from Ivoclar Vivident. You really have your choice, but this is going to be one where you don't want to just cement it into place because of that vertical wall height. And you're going to definitely want to use the IvoClean to make sure that the cement bonds to the crown as well in a situation like this. I've just got to the point where I want all my crowns to stay on and not fall off, so I use the IvoClean routinely with all my BruxZir and all my Emax restorations, just so I know I'm getting the highest bond strength possible between the cement and the restoration.